It's gonna be uncomfortable, but same.
All right, so you came back in 2 days ago, right, James? You saw me, was it last year?
Yeah.
You kind of dragged your feet coming in a little bit, still not sure, but you feel better, right? Wasn't sure if your neck pain was going to get relief. But what were you trying to avoid coming in to see me?
Yeah, I was trying to, I had neck pain, hands were numb, wanted to avoid any kind of, the needles and whatnot in the neck. So
yeah,
cortisone was going to work. Cortisone,
surgery, trying to avoid that. We had a documented MRI. You had some stuff going on there relative to some disc irritation on the nerve, and then had not had experience with chiropractic care. That's a kind of a hill to climb right off the bat. Like
Definitely
someone
not.
working on your neck when you know you have disc problems, but you were willing to try it because you wanted to avoid cortisone and I think that's a very realistic and common thread that I hear all day long, and probably really common for people that are dealing with that problem in general, right? No one is like, I can't wait to get my cortisone injection. It's gonna be awesome. Yeah. So we got good relief with traction and adjustments and McKenzie method in your neck. Might have dry needled you a little bit if I recall.
Yeah.
It was a while ago. And then, so you're giving me a second chance now because we passed the first test.
That's about it, yeah.
Sign me up, baby. So let's see, you got, how long have you been dealing with the Achilles problem? Because you mentioned to me last year, and you're like, all right, let's sideline this. Maybe we'll deal with it one day.
Yeah, it's 10 or 15 years.
Okay.
It's a long time ago, an injury.
So you got an MRI showing that the Achilles tendon has tendonitis and some small tearing in there as well. So minor, not a full thickness tear of the tendon. That would be a surgical consult.
Right.
And then, have you ever had steroids and any injections and everything? Trying to avoid that again? All right. And then relative to that, like you described it yesterday to me, you're like, it's bothering me, And I'm looking at your MRI and I'm like, okay, that doesn't seem that bad, but what I'm reading is pretty, more significant. And then you're like, yeah, it takes me a while to get going if I sit down for 15, 20 minutes. I was like, oh, okay. So it's significant enough, but you've just dealt with it for a little while. So now it's not your main focus, but you'd love it to get better, right? So this is the second session, and it's not better yet, but it felt good with the treatment that you had 2 days ago, and this is the beginning, and I wanted to show you how we treat Achilles tendinopathy, or really tendonitis in any tendon, using a tool called Shockwave. I'm going to show you how I adjust the foot, do soft tissue work on the foot, as well as we combine it with physical therapy. So that's it for the talking. If you want to watch the video, you can see these modalities. If you have questions about what they do or how they help people, or if you want help finding somebody that does this stuff in your area, just comment below, and thanks for watching.
James, are you ready?
Let's do this.
Are you getting that same type of intensity right at that heel, buddy?
Yeah, there's a couple spots where it's like...
When he gets that spot that makes you hold your breath,
Yeah, that's the spot. That's
this
exactly
is kind of a paradoxical, but like you put your hand up and say, keep it there, right? Let him know right when you're on it, and he'll hold it there for a good amount. Because I think some of that edema that you have on your calcaneus, the swelling you have on the bone of your heel, is a big pain generator for you. Okay, not just the Achilles tendon. Okay, and this machine right here, more than even the one over there, can help with the bone. It's going to treat the cells of the bone itself really well. Okay, so kind of looping back in, right? We've got, and do you mind if I just take a pause real quick and show? So this is your calcaneus, this is the heel. where the tendon, the Achilles tendon attaches, okay? He's got swelling in the bone here, through here where it attaches. And that just tells you that it's been stressed over and it's an acute process. There's swelling on the MRI. He's got swelling in the bursa on the side of the heel itself. So it'll be tender to touch when that's the case. And then he has some strains or tears, small tears, of the ligament of the tendon right here. So it's called an interstitial longitudinal tear of the Achilles tendon right here. All right. You saw a radial shockwave that's going to treat the trigger points and the tension here, and it's also going to treat superficially this tendon. And then now Eddie kindly is using the focus shockwave through the attachment sites where he has some of that edema. Focus shockwave is cleared even to treat non-union fractures, so it's good for treating bone. It's the only thing in here besides rest and time that I can do to help assist in bone healing, and really the only thing that I'm clinically given the green light to do in terms of treating bone is using focus shockwave. So I'll see it for shin splints, I'll see it for stress fractures, and in this case edema itself will be treating that stress on the bone with the focus shockwave. So this will be the focused, this will be the intention early on, and then we'll go ahead and load him afterwards. So I just wanted to share his exam findings as well as the actual MRI, and then describe a little bit more of like the differences between the radial and the focus shockwave and how we're applying it in the case here for this type of chronic injury that he's dealing with. So excited to help him out, and excited to show you guys along his journey how we've helped him out. So we got to make it happen, don't we, Eddie?
Absolutely, absolutely.
Let's go, Eddie.
Let's do it.
Let's do it.
James, did you get all that?
I got it.
Good, good.
Okay. Imlodipine. Procipiation.
Something like that.
Proprioception.
Good. Point down for me. Good. A little pressure through tib anterior over the mortise joint. I'm working on the, it's called the ATFL ligament, anterior talofibular ligament. Right in this area here, that's where he's got a little stress response in the MRI. So just ischemic compression, pin and stretch, working through this tissue. This is an ART protocol for it. This will help it feel better and move better. Okay, go ahead and pull your toes back. I want to work adjacent to the Achilles tendon here. Go ahead and push your foot into me. How was PT?
It's good.
Good. All right, and then back up. Point at me. You're gonna feel a little release here, okay? Just like that, okay? But a little quicker for me. Good. A little pressure in the knee. That's good. Virginia. There it is. Alright. Let's go 2 for 2, man. Let's make this happen. Table up, do the stretches in between the sessions.
Yep.
I'll see you next week a couple times, okay?
Yep.
Hey, thanks for watching.